Hey, I'm Dr. Kyle McKinney here at McKinney-Graham Dental Arts, and we're starting a new series where we're going to start going over different cases, whether it be cosmetic, implant, orthodontics. We just really want to start diving in for patient education and going over some of the cases that we're completing here. One of the first cases I wanted to go over was a cosmetic case that we've pretty much gotten to completion, and can walk you through some of the steps of when you walk in as a new patient for one of these consults. What are we looking for? What do we see? And where do we go from here? So this is one of my good patients, and he had approached us. He'd been in the practice for a long time. Approached us about just wanting to have his smile back. He'd lost what he wanted to see. So from this very first photo, which we go through a series of, this is just what's called like a resting position. And when he was in a resting position, you really couldn't see his teeth anymore, which you can see from this photo. Most patients, you want to be able to, males, you want to see a little bit of their incisal length of the front teeth. Females, a little bit more. So there's always a parameter we're trying to follow. So immediately, as we start taking photos, I'm looking at what does the patient show, what do they not show, what should they show. So this is that lip at rest photo that's usually a good starting point for me when someone's looking at a smile, because I want to know, typically that's going to be, I want to get length back, I want to get my smile back. This is actually his smile picture. And what I see here is I'm still not getting the tooth display that I would want for a cosmetic smile and presentation. I start to think about how much wear this patient has, thinking about sleep apnea, nighttime grinding. I go through acid protocols in my mind. So there's a lot that as we're looking at, hey, I want a new smile, your dental provider's going through, how did we get here? Why did we get here? What do we need to correct? So this is an intraoral photo, which we take these series to. And we take a lot more photos than these when we're evaluating your case. But this lets me evaluate further, okay, what is his current maximum bite? Where do the teeth fit together? What's the puzzle piece right now? And where do I want it to go? And this just confirms that he has had a lot of loss of tooth structure and height. Like if we look at where I want the teeth to be, especially just looking at his two upper central teeth, those should be significantly longer than they are now. I mean, a good 5-6 millimeters could be possible here, just depending on where that lip at rest is going to finish. So I see that, okay, he is having some wear. He's probably has some nighttime function that we need to take into consideration. But to get him his smile back, I'm looking at opening up his bite. He needs length back. So these are another photo that we take that continues to evaluate the wear patterns. You can see on the patient's right side, which is on the right part of the picture, that those premolar teeth, which are the two that are third from the back, have received a lot of that wear. And I think that probably occurred more so as he lost his molar teeth on the left side. So I want this view to see which tooth, if I go tooth by tooth, what does each tooth need? I can see a tooth that's got an old metal filling that is heading towards failure. That's going to need a crown. I see a fairly healthy tooth, but I see where he has worn down literally to the next layer of his teeth. Your teeth are in layers. The outer layer, the white part that you see, is the enamel. The next layer, the yellow part's the dentin. And you can see where he is worn through to literally the next layer of his tooth. He has no enamel on the top of his teeth anymore. So I know we're going to at least do 1 or 2 implants on this patient. I know we're going to need to do a full coverage or a smile design that's going to bring length back to those other teeth. This is the same shot, but of the lower teeth. It confirms the same thing. A lot of wear, patterns that are showing themselves that we need to make sure we correct that in our final design. Because one interesting thing about how everybody's development is the soft tissues develop first, then your bone formation comes, and the teeth are actually last. So where you've developed can make in your teeth are there. They just have to fit the function of everything else. So sometimes a patient like this, the teeth just were never in the right position, and where his jaw wanted to be and where his teeth were competing with each other. So same evaluation here. We have a lot of previous dental work. We've had some tooth loss here in these front teeth. Another filling that's showing age. Even some of the white fillings are showing that they're ready to be upgraded. So what we do is, in addition to all those photos, we take a lot of digital scans. I shouldn't say a lot. We're going to take digital scans of these patients and start doing our workup. I want to have models of where you are, where I think you can go, and where we want you to be. So this scan is where I've just done a quick mock-up of the patient of just the 2 front teeth. So I brought them in and we worked on changing the bite just with the 2 front teeth. And looking at where's that tooth display going to be? How earlier we talked about he really wasn't showing any teeth. So I want to see how much length could I get back? What's he going to show? And what is that going to do to our bite? So this scan allows us to evaluate the bite. And this ended up, after a little bit of adjustment with the patient chair side, we found that this was a comfortable position. It allowed the jaw to be in the right place. The muscles felt comfortable. And we're going to get space to get our length back to the teeth. Because you always want to be as conservative as you possibly can be. In a patient like this that just wanted a prettier smile, but what we saw was that with the tooth wear, if you just left him in that bite, he's going to have these short little white teeth. That's not what he's asking for, and it's not what he needs. So you can see where in this new scan we have the openings where they need to be, because this is an additive case. We want to add back to your teeth. I don't want to further take your teeth away. I want to build back what's there. So after doing our initial preparations and planning and using that new bite as a design, this is the patient in a mocked up full template of teeth. The teeth had been prepared for the final. It was a mix of crowns and veneers. And we've put on his temporary teeth, and then that allows us to evaluate how's the smile look. Did we get the shape right? Do they fit his face? Is it the right design? Is it color is not what we're evaluating here. Temporary materials only come in a variety of colors, but one thing I will do with patients is I try to leave them in a really bright white temporary, because that gives me, when we will pick your color, and I will always have my preference, but I'll listen to patients too, but I want to leave you in something really bright and white, because that can set a parameter of what's that patient desire going to be. Is a bleach shade, is that going to be too bright? Can we tone it down? Do I need to turn it up even more? Because everybody has a different thing that they want to see when they smile. So I always use a bright white bleach shade when I'm doing the temporaries, because it gives me a field of, okay, this is what that patient's going to want. So to me, this is too white for this patient, a little brighter, but he and I both liked the shape, the smile, the design, everything was perfect from our lab here in this case. So just to review, this is back with the original bite and lead us into the finals. So you can see this is where we started, this is where we ended up. And actually in this photo, the patient is still, we hadn't restored his implant yet that he got on the upper left side, which is on the right side of the image. And he had a couple crowns to go, but this is what, looking at him cosmetically, we fixed the first 20 teeth. We have gotten his length back. We've gotten the shapes right. We have healthy tissues. We had a solution for the missing lower teeth in the front, and so we're able to take a patient predictably from where they come in to where I want them to go. And you can now see where the patient doesn't have the end-to-end touch of the teeth. He's got a full overlap like he should. The phonetics are appropriate. The function feels right. It fits good to the patient, because that's something that's really important. You can't just get the smile you want without it fitting with the function of your jaw and your muscles and being comfortable. So this was again his starting smile, where he really had no tooth display. And then a very nice, comfortable finishing smile where we got the right tooth display. He's very confident in his smile. It's age appropriate. It's the right color where it is a brighter, wider smile than what he had, but doesn't have an unnatural appearance to it. That's always really important to us here, is that yes, it's a new smile. People that don't know you are going to say, wow, what did you do? This looks great. But it's going to be shocking and new sometimes for the person wearing it. But somebody that doesn't know you and doesn't remember that they couldn't see your smile before, they're going to know that you have a nice, natural, pretty white smile. That's what's really important to me here. And I think we accomplished that for this patient. So I just want to wrap up with saying, if you've had some of these thoughts about your smile, have some questions, know that we do an in-depth consultation for you. We'd love to be able to answer that. And the starting point is just to click the link below and let us know that you're interested.